Kenyatta University Teaching, Referral and Research Hospital is the boldest, most sophisticated health facility initiative ever undertaken in Kiambu County and Kenya. A project that has created a global health center that ensures Kenya and the region has world-class facilities that cut across the entire health arena to serve generations and contribute significantly to the Kenya Big Four agenda, specifically universal healthcare for all and the global sustainable development goals.
The hospital has continued to be an amazing development in this sector, specifically because of the new ways in which it adopted in terms of policy, in terms of treatment and general healthcare improvement and reform.
Kenyatta University Teaching, Referral and Research Hospital is a 650-bed capacity hospital with state-of-the-art medical equipment.
It is one of the iconic referral hospitals within the Ministry of Health and even for this country. And we say that because it is a modern hospital, it has been built and equipped with the latest technologies that are available globally.
The hospital is located on a 100-acre piece of land that lies in the northwestern part of Kenyatta University, bordering Kahawa Barracks to the south and the Northern Bypass Road to the east. The main entrance to the hospital is on the Northern Bypass Road near Kahawa West. It is easily accessible from main roads and public transport services. The hospital also has a helipad, a landing strip to enhance access. Following the preparatory phase of design and preparation jointly carried out by China Jiangxi Corporation and Kenyatta University, groundbreaking was undertaken in 2011 with the objective of providing a world-class healthcare in Kenya and the region. Kenyatta University Teaching, Referral and Research Hospital was the brainchild of Professor Olive Mugenda, who initiated the preparation of the proposal and leading her team from Kenyatta University in making a case for the hospital through the Minister for Finance, who is now the current President, President Uhuru Kenyatta. The government approved a government-to-government loan from China Exim Bank for construction and equipping of the hospital. The hospital was constructed and equipped at a cost of 8 billion Kenya shillings.
I'm very delighted to see a vision that we started 10 years ago being actualized and saving lives, particularly at this time of COVID-19 pandemic.
It was the founder's vision to establish a world-class healthcare facility which will reduce to the barest minimum traveling out of Kenya for medical care abroad and, at the same time, attract medical tourism from other countries in Africa. Our vision is to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens. Our mission is to enhance quality of lives through provision of quality, patient-centered and evidence-based healthcare, training, innovation and state-of-the-art technology. Built and benchmarked with international standards to provide world-class healthcare. It is headed by a team of dedicated, experienced and qualified doctors supported by a professional cadre of trained nurses and paramedic staff. KUTRRH houses advanced and sophisticated clinical and surgical facilities, providing comprehensive care to address all aspects of health, from prevention to diagnostic and treatment to rehabilitation. Deliberately and carefully built in the fabric of KUTRRH is quality. The KUTRRH Board of Directors is responsible for the management and administration of the hospital. The major directorates of the hospital are Clinical Services, Nursing Services, Corporate Services and Administration, Finance Strategy and Planning, Training, Research and Innovations. At KUTRRH, we believe quality is never an accident, but a premeditated effort. The hospital is among few in the region to function with full-time doctors system that assures doctors' availability around the clock, giving dedicated time and attention to patients.
We mainly deal with offering clinical services and ensuring that all patients are treated accordingly. My division is very wide and it encompasses a lot of various disciplines, majorly of which is oncology services, accident and emergency, trauma and orthopedics, where we are able to perform surgeries. We have a fully established pharmacy, which is able to provide nearly all kinds of drugs. In terms of laboratory, the whole pathology area, we have a well-equipped laboratory. We are able to do state-of-the-art tests.
The highly sophisticated medical center shall offer quality medical care within the following units: outpatients, accidents and emergency, pharmacy and diagnostic imaging; inpatient services, pathology and lab medicine, critical care, medical and surgical; special internal medicine, oncology, renal and neurology; obstetrics and gynecological services.
As a hospital, and more specifically as a pharmacy department, we pride ourselves with offering high quality services because, as I mentioned, our staff are very highly qualified. Then number two, our drugs are of assured quality because of the kind of sourcing that we go through just to bring them to the hospital.
Critical care, medical and surgical. ICU HDU. KUTRRH has the highest ICU and HDU bed capacity among healthcare establishments in Kenya. There are 54 ICU beds and 10 HDU.
The beds are fully equipped with world-class bedsides where there is panels of sockets where we use to ventilate the patients. It has world-class machines for infusion of medications and drugs.
The Department of Anesthesia and Critical Care, we provide services in all these departments, especially theatre and the intensive care unit. But we also offer anesthesia services to support the Department of Radiology whenever they're having interventional radiology procedures, the cath lab, the endoscopy unit, as well as sometimes for some radiotherapy procedures.
Oncology Cancer Unit. The ultra-modern oncology unit is a beacon of hope, health and happiness.
Our flagship project is Oncology Center, where we are dealing with cases of cancer. And we are undertaking very good services in radiotherapy and also radiology treatment with great outcomes.
The team of oncology specialists work together to develop individualized treatment plan for every patient with great results.
This team consists of the oncologists, the surgeons, the palliative nurses, our nutritionists, physiotherapy, the pathologist, and our oncology nurses. And once a week we have this meeting, the multidisciplinary team meeting, where we discuss the management of all the patients who were seen in the previous week so that we can make the treatment of every patient a focused and patient-centered treatment to target the specific needs of every patient.
We offer cancer care services across surgical, radiation, and medical oncology. Every unit is equipped to treat every type of procedure, including trauma and surgeries. The ultra-modern laboratories are equally proficient to delivering high standards of services.
And we have the best equipment that you can find in any part of the world, like Europe and USA. And that means that you are able to diagnose the most complicated diseases without sending samples outside the country. And it also means that we are able to give the best teaching and practical approach as far as the students are concerned.
The numerous conference halls equipped with teleconferencing facilities will enhance continuous medical education. Embracing new technologies to offer high-level healthcare that matches the best globally. Medicare is further supported by the availability of telemedicine to enable doctors consult with peers worldwide on real time, thus reducing the need to seek treatment abroad. It is expected that the hospital will provide the necessary environment and incentives for the conduct of biomedical research and clinical trials in order for our medical scientists to contribute to improved medical care and production of new pharmaceuticals. Kenyatta University Teaching, Referral and Research Hospital believes healing begins as soon as you arrive at the hospital. At the core of our new design, the idea of personalizing and humanizing the healthcare experience will be apparent at the hospital. Furthermore, the hospital premises provides a green, relaxed and soothing environment for healing and visits. Given the advanced facilities the hospital presently has, combined with the human resources being assembled to undertake medical care, research and training, we hope to meet the expectations of Kenyans in the provision of quality healthcare. KUTRRH is one of the main COVID-19 centers in Kenya, being used for the isolation and treatment of COVID-19 patients. However, we also offer medical services in oncology, renal, pediatrics, and other specialties. KUTRRH recognizes the need for collaborations and partnerships. This internationalization programs gives our doctors, staff, and patients the opportunity to interact with doctors and specialists from other parts of the world.
We're building strong partnerships, for example, the University of Manchester and the Christie Foundation in the UK. We also received 20 Cuban doctors that are helping us fight the pandemic. After that, they'll be deployed in the counties.
The new Kenyatta Memorial Funeral Home is open to the public. The support services which complement medical care in the hospital are Doctors Plaza, Staff Quarters, Academic Block, Laundry and Catering Services, Restaurants, Helipad, banks, among others.
If you look at the infrastructure around this hospital and you look at the keen interest that the government has, if you look at the keen interest that our Cabinet Secretary of Health has in this hospital, and if you look at the need in the market, in the region, and even in the locality for this hospital, it's very, very clear that if we get our act right, this is going to be a hospital that is a game changer in the region.
Kenyatta University Teaching, Referral and Research Hospital has continued to embark on projects aimed at providing quality healthcare. The ongoing projects include the construction of furnished hostels and apartments that shall provide accommodation within the hospital premises to patients and their families while undergoing prolonged treatment. An important ongoing project is the construction of the Integrated Molecular Imaging Center, IMIC. This iconic comprehensive cancer center shall provide medical relief to Kenyans and beyond.
We are very happy that our President has approved the construction of the Molecular Imaging Center. The Molecular Imaging Center will house the cyclotron, it will house the PETs and CT scan machines for early diagnosis of cancer. And this center will be the first public center in East and Central Africa, and will go a long way in helping Kenyans access the necessary treatment without having to go to other countries like India and South Africa. I would like to thank the President and the Minister of Health for their support and their interest in ensuring that this hospital becomes a center of excellence in Kenya and the region.
Given the advanced facilities the hospital presently has, combined with the human resources being assembled to undertake medical care, research and training, we hope to meet the expectations of Kenyans in the provision of quality healthcare.